Hey guys, Dr. Luke here with RecoverRx Physical Therapy. I wanted to talk to you about this new series I'm going to be running called Should I? All right. Today, I'm going to be going over one of the most common questions that I get in the clinic here at RecoverRx Physical Therapy, and probably one of the most common questions in general for physical therapy is, should I ice or heat? All right. Big question, and quite honestly, it's a very confusing one for many patients because the recommendations change, it seems like almost daily with what you should be doing. And based on who you follow or what you've been told in the past, you may have basically a predisposition to choose one or the other. So I'm going to try to debunk some of the myths associated with each one and then just give you some tactical examples of when to use one versus the other, because I don't think there is a really good right or wrong here, and quite honestly, some people get benefits of one versus the other. So should I ice or heat? All right, I think that it's very important to understand what the condition is that you are trying to treat with this specific modality, and then go down the rabbit hole of why you're using one versus the other. So when we're talking about ice, right? When we think about ice, what do we think about? We think about cooling down, slowing, decreasing inflammation, trying to prevent swelling, right? So, in the past, it was always talked about the RICE method, rest, ice, compression, elevation, after acute injury. Really common examples, like after that acute ankle sprain, when you roll your ankle and it blows up like a softball, what should I do? I mean, it's always been prescribed in the past to RICE, rest, ice, compression, elevation. All right. We're starting to see some changes in the literature to support that actually heat and motion are almost more beneficial after that acute kind of injury dies down. But I'm still giving some recommendations for ice as a way to really modulate pain, meaning if you're having high pain, I feel like ice has a better pain modulation than heat at this point. So, if you're in a lot of pain, acute pain, I'm typically sending you towards that ice, all right? So you're using some sort of cold therapy, ice therapy to address the acute pain symptoms. Or if you do have a great deal of swelling, whether that's in the knee or the ankle or somewhere that you've had the injury, you're gonna go with ice to try to bring that down a little bit, all right? Now, I will give people heat early on, acutely, if they're feeling locked up, tight, stiffness. They wake up in the morning, they're very stiff. Then we're going for a heat modality, whether that's a heat pack or that is a hot shower, or just getting their body moving, right? To internally heat up that tissue to get it loose. It's nice to have a little bit of that heat to externally as well, if it's surface muscle, surface tissue, to get you warmed up, get you ready to go and get some pain down, all right? So again, an instance where I might give ice, where I might push you towards ice, acute pain that's pretty high, with some swelling in the general area, we're ready to put some ice on it. It does help modulate pain. It does take the edge off the discomfort, and it will also help a little bit with that swelling as you constrict those blood vessels, all right? But very quickly, I'm gonna try to get you off that ice and get you towards heat, all right? We wanna bring new blood flow. We wanna bring those healing chemicals, healing hormones to the area to help flush out that old blood flow, that stagnant inflammatory blood, and bring in some new good, well-nutritioned blood flow to the area and help with regeneration and getting you back to normal again. So we'll use heat very quickly after we've gotten the pain down and the swelling down, and we'll go and start using heat with early in the morning with warming up and for any sort of pain modulation after that. So when you're thinking about when I should use the ice or heat, start to think about, is it acutely very painful and with some swelling? Move to ice. If as soon as possible as you can get more towards the heat, start to move towards that respect. If you're just dealing with stiffness and some aches and pains, I would sway towards heat at this point to try to promote blood flow, try to promote tissue healing, and get you back to doing the things that you want to do successfully, all right? Look out for more episodes of Should I Do This or That? we're going to have a bunch of different common questions that I get from patients, and I'm looking to hopefully just give more info to people so that they can help themselves, all right, and be accountable and take some ownership in their recovery. So if you like this video today, give me a subscribe on YouTube. Follow my stuff on Instagram at RecoverRxPT, and just share with your family and friends, because I think this information is very important to get out and help debunk some of those common myths that people have regarding ice and heat. Thanks, guys. Check you later.